Okay, so what we're going to be covering today is some just general body positions that you will be doing in radiology. So when we talk about just general body position, it's just the general position of your patient. So what we're going to start off with is the recumbent position. So remember that recumbent, all it means is the patient's going to be laying down in any position. They can be on their side, on their stomach, on their back. Recumbent just means laying down in any position. So we're just going to get my patient here to lay recumbent. So she's just laying in any general position. Now I want her to be in a supine position. So what I need her to do is lay flat on her back. Good. So that is our supine position here. Now what we're going to have her do is lay onto a prone position. So prone position means that she's going to be laying onto her stomach. So she's going to turn all the way over. And when you have patients moving in these positions, you always want to assist them and guide them. So here is our patient in a prone position. We can also do oblique positions, which an oblique position is the patient is neither flat on their stomach or flat on their back. The mid-coronal plane is not parallel, the mid-sagittal plane is not perpendicular, it's in between. So if I want her to lay in an oblique position, I'm going to roll her up a little bit towards her, either right or left. Let's get her this way. So see how now the mid-sagittal plane is neither perpendicular and the mid-coronal plane is neither parallel? This is an oblique position. Now I'm going to get her into a lateral position. So we're going to lay her onto her side. So if you'll lay facing that way, her arms are going to go forward. Good. And when we have patients on their lateral side, the laterals are named according to the way the patient's laying. So she is laying on her right side. So this is a right lateral position. If I needed her to lay on her left side, so let's go ahead and have you lay onto your left side. So she's going to be facing me. And again, when you have patients, just go ahead and assist them, guide them. And this is a left lateral position because she's laying on her left side. The other position that we're going to cover is a Sims position. And this is when she is in an oblique position with the leg, the top leg bent and the bottom leg straight. And you're going to just roll your patient forward. So this is a Sims position. Okay, if you will stay on your left side. So I'm going to put her on her left side. And now what we're going to do is be covering a decubitus position. So a decubitus position is when your patient is laying in a recumbent position. So she could be laying on her back, on her side, on her stomach, but our central ray is going to be horizontal. So for a decubitus position, our central ray is going to be horizontal, and then it's going to be perpendicular to the image receptor. So just imagine that our central ray is coming this way horizontal, and the way I have her here, so this is going to be a left lateral decubitus because our central ray is horizontal and our patient is laying down and she's laying on her left side. Okay, so now if you'll roll back onto your back. So I'm going to still keep a decubitus position. So my central ray is horizontal, my image receptor is vertical, but now we are in a dorsal decubitus position because my patient is laying on her dorsal side, on her posterior side. Okay, now if you'll lay onto your right side facing away from me. Again, she is laying on her left side. Because my central ray is horizontal, my image receptor is perpendicular, this is going to be a right lateral decubitus because my patient is laying on her right side and my central ray is horizontal. Now if you'll lay back onto your stomach. And I'm going to maintain my central ray horizontal, my image receptor perpendicular, but now she's on her stomach, so she's prone, but because my central ray is horizontal, this is going to be a ventral decubitus.